Welcome to Canine Wellness Online. Today's video is part of week 1 and a little side note of things you should watch out for. So what is normal and what's not normal. So let's talk about what is normal to see when your dog is home for the first week. So swelling and bruising. Most dogs, and here's a picture above of a dog, this is like 2 days after surgery. Most dogs will have some bruising. It's to be expected. And swelling is very normal, as well as you may see a little bit of blood coming out or clear kind of fluid with a little bit of blood tinge to it. That's completely normal. So let's just quickly talk about what's abnormal. So if after the first few days your dog has some liquid coming out of the surgical area and it looks like a greeny color or a yellowy color or thick, that's a little bit of a red flag. So you may want to talk to the surgeon about that. They may want to give your dog some antibiotics. The other thing is if swelling is not going down, in fact if it's getting bigger, then that's a red flag. And just as a segue, sometimes what will happen is the swelling will go down to the ankle or the tarsal joint. I've seen a number of those dogs. Typically that's just gravity. So the swelling is dropped down. What you can do for that is a little bit of massage, and what I tell owners to do, if Ben is going to be, no, you stay there, is just taking the leg and just moving, just taking your hands and moving fluid upwards. Obviously you're not going to touch in here because that's where the surgery was, but if you're just gently moving the fluid towards the body, that will help alleviate any of the edema that has gone down to the bottom part of their leg. And again, I have seen that a few times, so typically that's not something to worry about unless you see that happen where the swelling has gone away and then come back. Then you definitely want to speak to your veterinarian.